Let's go to Delhi in India and speak to Dr. Sandeep Nayar, who is the Senior Director and Head of the Respiratory Department at the BLK-MAX Hospital. Doctor, thank you for your time. Just to ask you a question which is extremely pertinent to your specialization, what about the research that shows at the moment that the Omicron variant doesn't affect a patient's lungs as much as the Delta variant? Have you found that?
Yeah, of course. I've seen that the Omicron virus is mainly attacking the upper airway. It's not affecting the lung as much, so we have less of hospitalization, less of fall in saturation, oxygen saturation. But at the same time, it is spreading very fast. So on the one hand, we are having a less severe patient, but on the other hand, it's spreading very, very fast. So for some reason, and fortunately, the lungs are spared as of now with the Omicron. But the Delta virus was involving lungs to such an extent that we had most of the patient having falling oxygen at the hypoxia and going on the ICU and even on the ventilator.
Do you think we will eventually find, once we have enough data, that the risks of long COVID amongst Omicron patients will be as high as the risks of long COVID for those who've had Delta?
Yeah, who knows? Because we are still struggling with the patients who had Delta, and they're still coming to us with post-COVID or a long COVID sequelae and having a tough time. And it's too early to say, because Omicron is just a few days back. It has just came about 15, 20 days back. It has come. So we don't know. We don't have enough data to see what are we going to have it in our future. And I doubt it, because this COVID-19 is surprising us every day. So I have a fear that we might have a post-COVID sequelae, and that's why I say whatever mild symptom it may be causing, but be careful. You can never say it's a mild disease. It may have mild symptom to begin with at time, but who knows, we may have a post-COVID sequelae which might be even bad. So let's be very, very cautious, try to avoid it. That's why COVID-appropriate behavior and vaccination stays above all.
So your city is going to have a weekend curfew coming up, the first of what may be many weekend curfews. The cases, I believe, in 7 days have quadrupled. How quickly do you think that the hospital system is going to come under stress, which will obviously affect everything else, as we heard in that report? When COVID infections fill up hospital beds, the healthcare system in every country, there's a trickle-down effect to every single patient who has all sorts of different possible medical conditions.
So absolutely, you know, that even like they say, it's a mild disease, but when it starts infected, when the denominator increases, the numerator also starts increasing. So if the more and more people get involved or infected, so they will not spare even the elderly or the patient with a comorbid condition or immunocompromised patient. They might have more severe disease. And to add to it, even the healthcare workers starts getting infected. Many of my colleagues have already got infected with the Omicron. So however mild it may be, they will not be working for, say, 7 to 10 days, depending upon your quarantine facility. We had a quarantine facility for quarantine for 10 days initially. From today onward, it has been changed to 7 days. But still, 7 days, a healthcare worker going out of it will be definitely stretching the healthcare system. So we are one side we are struggling with the COVID Omicron, but on the other hand, the healthcare facility will also be stretched, and that's what actually happened on a second wave when we had it. We almost ran out of oxygen and beds because the patients were increasing like anything. But fortunately, as of now, even despite having increased number, tremendous increase in numbers, but the hospitalization is very, very low. For example, in Delhi itself, the capital itself, the numbers have increased from 400 today to 10,000 per day within a gap of 5 to 6 days. But fortunately, there's not too much of hospitalization, and I hope it remains mild and it goes down as early as we have seen in South Africa, almost a vertical spike, and is going down very steeply. I hope we all get spared by this Omicron.
Yeah, everybody is hoping exactly the same thing happens in their country as happened in South Africa, as you pointed out. What do you think the chances are, as Delta replaced Alpha and Beta? I mean, the WHO basically almost is declassifying the Alpha and Beta variants because they almost don't exist. What do you think the chances are of Omicron replacing Delta, or do you think these two variants are going to exist concurrently and cause sort of a dual pandemic?
So as we all see all over the world, we are seeing that Omicron is taking over, and majority of the new infection which we are getting it now, Omicron is increasing its percentage or the ratio in the total of it. But we fear we might not, may have both of them, because still we in India it takes time to get our genome sequencing, and we are not doing in all patients. And by the time the patient comes to you, it's very difficult to distinguish whether it's an Omicron or it's a Delta, and you have to treat both. But having said that, I'm also feared that there's no combination of the two, the Delmicron, which is again one of the feared variants which might come. And now we are hearing another another variant coming from the France, and so on and so forth. So this viruses tend to keep on mutating. Well, that's the nature of the virus. And after 32 spike mutation, Omicron has come. It's seemed to be a milder infection, but you never know the way it is spreading. It might infect more and more people. So I hope that I'm not in. I'm not. I don't hope it one replaces another. I hope all of them go out, and we get saved from this monster, which is COVID-19.
Dr. Sandeep Nayar, thank you so much indeed, sir. Really appreciate it.